Hello everyone, we're here with Dr. Maysa, one and only holistic dental surgeon in Doha, actually in the region. Do you know anyone else in the region?
No, not really.
Yeah, I think if anyone knows anyone else, please correct me. And we've got the team here. Hello, Adam. Hello. Got another one over there. So I've got an army to remove my last filling of maybe 15. I had maybe 15 Mercury fillings.
Quite a lot.
It's taken me 6-7 years. So why is it important to remove Mercury safely?
Well, amalgam fillings contain, they are really alloys. Alloys of metal contain about 50% of it is mercury. And mercury, although it's in the alloy form, it does escape throughout the years with eating and brushing and using the teeth in general. So it actually sits in your body, especially in your nerves. And it is very difficult for our body to get rid of it because not everyone has the proper liver mechanism to get rid of mercury. And it usually stays in nervous tissues in the brain. A lot of diseases have been related back to mercury toxicity, like Alzheimer's and Parkinson's and so on. But for general health, I do not think that amalgam fillings are safe on anybody. There is no safe level, absolutely no safe level of mercury in the body, especially for women who are breastfeeding or pregnant or for children in general.
And they actually say you know the toxicity of your child, but how many mercury fillings you have in your mouth when you're pregnant. So I had like 15.
Wow.
Then I had 12.
And
then I had 6.
And mercury crosses the blood-brain barrier.
It does,
so
sadly it does. But I've been preparing for the removals for years, and this summer I spent all summer preparing by taking all the right supplements. What are some of the supplements, some of the precautions that you like your patients to take before taking the mercury out?
Well, I'm not an expert on detoxing. I would leave that to the right people, but I would prescribe things like a high sulfur diet and things like alpha lipoic acid because it's a strong antioxidant and it also dissolves in fat. There are other also supplements and dietary supplements that people can take, and I would like them to start ahead of having, of planning. When they're planning, to start ahead at least 2-3 months before they remove their mercury fillings. And things like coriander, for example, binds to heavy metals. Basically, we need to bind these heavy metals and enable the body to rid of them through the liver pathways.
Well, some practitioners say it could take 4 or 5 years,
Yes,
especially the ones in the brain, because these things deposit themselves into the brain. So it's not the easiest thing to take out of the body. But what people don't realize is after you remove your mercury filling, you have a honeymoon stage. So you feel really good initially, and then this stuff starts to recirculate into the body if you don't take precautions.
Yeah.
And there are people who actually felt, they did really suffer after removing many in one go and just suffer afterwards. So really you need to take precautions. But what do you do whilst you remove the mercury to ensure the patient has the least amount of exposure to the fumes, to the mercury?
Basically, the vapor of the amalgam, the vapor of the mercury is a lot more toxic than the mercury filling itself. So basically, while drilling the amalgam out, you tend to generate a lot of heat, and that's why we use proper isolation mechanisms using rubber dam. And when we drill the amalgam out, we use a lot of water to cool the drilling process because we don't want the methyl mercury to escape. But methyl mercury is going to escape and there will be vapor around the room. So we prefer that patients have oxygen mask on them while they're getting the amalgam removed. And we prefer to also have mercury filters running in the room as well to make
So
sure
you have
we get-
those. We have them. Is that the Mercury filling?
Yeah.
Oh, there's that there.
behind you.
Where is the? Can you show us the? Apparently we're low. They can't hear us, so we have to scream a bit. But can you show us the oxygen? Show the one. I know it's broken, but just show it anyways. There's an oxygen. Can you hear us? Can everyone hear us? We have a few people. We have 5 people online, but they're saying 2, but there's 5. I think the volume is low, but we'll try our best. This is my first time doing a live, so I'm doing my best. I have to listen to it after. How do you do that? Oh, does that sound better? Can someone tell us if that sounds better? Meenakshi, does that sound better? So, well, okay, great. Thank you so much. So, this is the oxygen. So, it's an oxygen device so that you. So, what's the oxygen for? Why do we need to have the oxygen
Well,
when we're
because
removing?
when you
Let me just turn this around again.
when you remove the amalgam, basically you'll have a lot of isolation around your mouth, so it's hard for you to breathe through your mouth. So the only way is you want to breathe through your nose, and we don't want you to be involved in this smelling of the amalgam byproducts, like I said. So we place the oxygen mask for you to have a safe way of breathing, so you don't breathe the air in the room.
And what do you do for yourself then when you're removing?
Well,
do you
we wear specialized masks.
Can we see the mask that you wear? It looks like some sort of World War II kind of concoction. Is that, there we are. Those are the masks. We're going to look at the mask that the dentist wears. And there we are, Dr. Maysa. Show us. Maybe we should have got one that is. This is the mask that the dentist and the team has to wear. I mean, it shows you how dangerous this stuff is. Yeah.
Well, basically, this is a good protection, and you know, at one stage, dentists in the past have had a very high suicide rate. It's
Because it affects your. Yeah, you know, we've got Mad Hatters. If anyone, you know, if anyone wants to investigate Mercury further, look up Mad Hatter's disease. And also, you use a vacuum. Can we see the vacuum? We'll have a look at the vacuum. This is this vacuum that I hold. Can you see it? Woohoo! I'll use this vacuum. I'll put it down on my chest, and that kind of vacuums the vapors.
Yeah, it helps to suck out all the extra vapor from the mouth, from the area we're working on.
And you use a dam, which is like a plastic device you put around the tooth.
Yeah.
So that when you drill, it just falls into the plastic device. And these are all precautions that you take, but still, it doesn't guarantee total.
Yes. This is the rubber dam. It's actually made of strong rubber, and where we isolate the tooth so that when we're trying to remove the amalgam, it does not get into the mouth as well, and you don't swallow it.
Yeah. So those are all the things I'll do for my last amalgam. But I'll be taking supplements and measures to detox and IVs for the next sort of 6 months to a year at least, so that I can get this stuff out of my body.
Yeah. I highly recommend, ongoing supplements like you said, Niloofar, and homeopathy is great for detoxing the system in a gentle manner, I would say. Along with other supplements that are done by an expert. I think it's better to take somebody's opinion when you're detoxing.
Yeah.
Because it can be strong on the system, yeah?
Yeah, it can be, and you want to do that. You want your liver to be functioning well, your whole body to be functioning well. It's not something to be taken lightly. I think, conventional dentists do kind of poke, fun at the holistic doctors, but they're not living in the body of our patients who come to us really suffering for years after removing the mercury, or if the mercury is broken, the filling is broken, is leaking into the body.
So removing the amalgam fillings is just part of the process. You need to look at other things as well. It's only the beginning of the step towards getting a better body.
Yeah, and health. So we're going to start. I don't think I'm going to show myself being drilled. Please say, bye to everyone, and we'll speak to you later. This was our first live
So we might do many of these in the coming. If you liked it, give us a shout, and see you later. Bye bye.